Hey everyone, it's your host, Charlie Dixon. Before we dive into today's episode, I'm excited to share a special announcement about the 2024 Fall Wellness Summit coming up on November 2nd and 3rd, starting at 9 a.m. Pacific Time. This free online event brings together four experts in heart centered hypnotherapy who will be sharing their knowledge on altered state therapy and the power of healing. It's an incredible opportunity to connect with the founders of the Wellness Institute, learn from top professionals, and network with peers in the wellness community. This event qualifies for CE credits. We're offering 4 CE hours exclusively for attendees of the 2-day event. After the summit, you can purchase the credits for just $19.99, which includes access to the presentation videos and your official CE certificate. Don't miss out on our final summit of the year. Learn more and register for free at triadhq.com/WIS. We look forward to seeing you there.
Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Charlie Dixon. Joining me today is Denise Schonwald. Denise is a nationally licensed mental health counselor, published author, and public speaker with over 30 years of experience as a registered nurse in the ICU. Her unique background fuels her holistic approach to mental health, integrating her deep understanding of the mind-body connection with spiritually based practices. Denise specializes in addressing challenges like anxiety, depression, marital issues, and childhood trauma, while her therapy dog, Henry, provides comfort during sessions. Passionate about supporting the mental health of first responders, Denise also engages in speaking engagements nationwide, advocating for the importance of mental and physical well-being in achieving overall wellness. We're excited to have Denise with us today to discuss the link between mental and physical health and how understanding this mind-body connection can lead to more effective and comprehensive patient care. Thank you so much for joining us, Denise.
Thank you for having me. I'm excited to be here.
Absolutely, absolutely. So as we get started today, can you share your journey from critical care nursing to mental health counseling? What inspired this transition? And this really one of the things that a lot of our listeners want to know is how people developed their change in careers or how they just got into what they're doing.
Well, first of all, I loved being a nurse. I thought critical care was something I would be in forever. But at a certain age, it gets difficult. There's long hours, it's nights, it's on call.
Mhm.
And yet I wanted to do something else because as a critical care nurse, you're really good at critical thinking and thinking quickly. And I felt like I still wanted to use that skill, but I wanted to do something else. I explored hospital administration, I explored being a nurse practitioner, but mental health counseling to me seemed like the perfect fit.
Okay. And so then how would you say that background in nursing, just like you mentioned, you were specifically a critical care nurse. So being able to use those critical thinking skills, how do you think that approach influences your mental health counseling?
One of the things that I loved about medicine and the body is I felt like the body's very sophisticated. So when it would do whatever it was doing in the hospital, it always made sense to me. As if you do it long enough, it makes sense to many of us. When I switched over to psychology, though, I thought it was very blurry as to like why people get anxiety and what causes depression. And I wondered like why mental health was difficult to figure out. I mean, to me, it just didn't seem quite as understandable until I really started to practice it. And I learned how the mind actually manifests if we don't manage the nervous system, how it actually manifests physically. And once I understood sort of the understanding of the science of psychology, I think it's fascinating.
It absolutely is. While I'm a social worker, I'm definitely still very fascinated by psychology and kind of how the body reacts to what our mind is doing. And since you mentioned that, can you give us an example or touch a bit more on how emotional issues can manifest physically?
It's interesting when I went through nursing school, one of the first classes that I took was anatomy and physiology. Certainly they want you to know where everything is and why. But there's actually an anatomy of emotional energy. certain emotions are processed in different parts of the body. For example, if we're around somebody and maybe we don't particularly trust them, I might say to you, I got a gut feeling this person isn't being truthful. And it's actually because trust is processed through some energy in the stomach. And we literally physically feel that for a good reason. Emotions, depending upon which ones are being processed where, once we manifest physically, that has started back in the nervous system in what they call the chi.
Interesting, interesting. So as you mentioned that, it really brings to mind how, it's back to school season right now. And so it
Mhm.
really brings to mind how children will be fine all summer long, no issues at all. But then when school starts, or maybe even when school becomes challenging, their stomach hurts or their head hurts.
Yes.
So can we talk more about some of those common physical symptoms, like I just mentioned, that can indicate some underlying mental health issues?
Yes. In fact, the first week of school, I can count on the phone ringing. So and so's home from
Okay.
school. He's got a really bad stomach ache. He can't seem
Mhm.
to swallow. Fear is also in the stomach. And so when children are going back to school and are not sure about their teacher and their classroom and all of that, that's something that will naturally happen. What I'm seeing a lot with children and anxiety is a lot of practitioners are treating it with diet and unfortunately in the teenagers medicine. We're seeing
Mhm.
them start on a lot of beta blockers, which to me is sort of unfortunate because no one's really getting to the root factor of why they're having so much anxiety.
Right, right. And can you maybe even go a little deeper into that? So, thinking past just children, so as adults, what types of physical symptoms may we see that may indicate further mental health issues?
Sort of an extreme one is if we could take breast cancer. So breast cancer, certainly there's a lot of things that contribute to something like that.
Mhm.
Anxiety and anger is very hard on the heart. So there's energy, and for women, obviously, our breasts are there, so our heart and our lungs. And if you work with somebody who has breast cancer, if you look back before they were ever diagnosed, there's likely a lot of anxiety, maybe a lot of anger, bitterness, resentment. These emotions are very hard on the breast tissue, heart, lungs. Typically, for anxiety, a lot of people will smoke or vape for that reason
Yeah.
to try to open up that energy, and they'll say that they do it for stress, but it's actually because the energy around the heart is very constricted.
That is really interesting. I never really thought about how deep that can. Of course, like you said, it is an extreme case with breast cancer, or maybe even any other type of cancer. But just thinking that I am so anxious and I cause my body to have a physical ailment is fascinating. It's a bit scary, I suppose, maybe even enlightening as well. So it's very fascinating to me. It really also then sounds like your approach to mental health is very holistic then. So can you explain to us your vision of holistic healing and how what that means to you and how you incorporate it into your practice?
Well, I think if we think about physically, when we're sick, we have pain or we have a symptom like a cough or something. And we're pretty good about calling the doctor and getting somebody to look at it. I mean, we're pretty good with that.
Yeah.
But when it comes to psychology or emotionally, we just somehow learn to live with our anxiety or say that our guilt comes from, our religion or wherever we're blaming it for. And we sort of incorporate these emotions into our lives. But what the body is trying to do is cue us that the nervous system's out of balance.
Okay.
If we continue to ignore that, so we go on for years and years and years, eventually the body's going to weaken and we're going to get sick. So it doesn't matter to me what kind of illness it is. It could be something extreme as cancer, but I go back and look at where in the nervous system this all started.
Okay. Okay. Speaking to then, that brings to mind then what does treatment look like? How do you approach treatment when a client presents with a physical symptom, whether it be something, maybe minor headaches to something more extreme like cancer? Then how do you kind of link those symptoms to their emotional mental health concerns?
When I first meet someone, I used to ask, my first question was, are you in good health? And they would say, yeah, I'm in good health. And I'd say, do you take any medications? And after they would list the fifth or the sixth one, I realized that they probably weren't in as good health as they thought.
Yeah.
So I've learned now to ask them first, what medications do you take? And usually I can, sometimes I'll say, what are you taking that for? But for the most part, I can piece it together.
Mhm.
So once I understand what the body is doing, now I'm understanding where I need to focus a lot of my questions. I ask about religion, hobbies, friends. I ask about trauma. I'm asking about a lot of questions because very quickly I'm putting a puzzle together. But I'm understanding what the condition of the nervous system is and what they're going to for ease. I certainly ask them about smoking, drinking, marijuana. If they say no to all of them, I say, what about like shopping or eating? Because when the nervous system isn't in balance, we will go to something for relief.
Right.
The mind becomes very active, and usually what we pick is not the best. If the nervous system is pretty well balanced, we usually go to our hobbies. People go, oh, I paint or I, whatever they do, they garden or whatever they do. And that tells me that they go into what they call your higher self and they pick more appropriate things to do for relief that are good for the body. Many times we have just bad habits or more bad habits.
Absolutely, absolutely. What are some ways that you know that a person's nervous system is out of whack, that needs some help? What ways do you know?
One almost right off the bat is that they don't have any hobbies. Like a lot of them will say something like, I like to go to the beach and we're in Florida. So I say, oh, how often do you get there? Oh, I don't know, maybe every like couple months. Okay, that's not enough. Or I like to travel. And I say, okay, well, how often do you travel? I mean, that would be an expensive hobby. But oh well, I don't know, twice a year we go to whatever. And I say, okay, well, what do you do regularly? Oh, I don't have time. The kids are busy and job is busy. Okay, likely that we're the nervous system's not in a good place.
Okay.
Then I'll say, "Do you drink alcohol?" "Oh, yeah." "Well, how much do you drink daily?" "Oh, yeah, pretty much." "How much?" If they're drinking a lot, nervous system's really out of balance.
Okay.
Drinking daily is concerning. Smoking, vaping, marijuana, concerning.
Okay. Okay. And is it just the act of doing those things, like, or is it the quantity? So let's say I do have a drink after work every day. It's one drink. Or does that make a difference versus having, going on a binge drinking run? Like, is there a difference there?
Well, as we know with one drink every night, after a while, the mind is very powerful. So once we know that one drink gives us some relief from a stressful day, it won't take long for us to need maybe two drinks. And so one thing I learned, I did a whole year of just studying addiction. Any sort of addiction or attachment are a very slippery slope.
Yeah.
We start to just have a little bit and then we have a little bit more because when the mind gets active, it goes to what it remembers that it liked.
Mm.
And so again, if you're drinking a lot or you're smoking a lot, that tells you sort of how much the nervous system is now out of balance. If
Okay.
I'm drinking 3 drinks at night, that becomes a lot of alcohol.
Mhm.
Or I'm eating a whole cake. I mean, there's a lot of imbalance there, and my mind thinks it needs all of that to feel better. It's trying to feel better. The body's trying to balance, just not doing it appropriately.
Okay, okay. It even almost sounds like then you're maybe even taking your clients on a journey, or helping them figure out how to first understand that emotion, like where they come from and how to master it. So can you talk to us about how this approach, when you take, helps your clients to master their emotions?
Well, certainly, as you know, in the field, it can be very challenging,
Yes.
depending upon if they're willing. So maybe they've had something happen and now they're really willing. We have a really good chance of creating, getting some good progress going. A lot of times when we struggled with anxiety for years and years and years, we get very committed to it
Mm.
or guilt. I mean,
Yeah.
sometimes I feel like I'm in Florida, so I feel like I'm wrestling with like an alligator to get rid of guilt or worry, and
Yeah.
they almost wear it like a badge of honor.
Yeah.
I'm a worrier, and I go, okay, well, that's not good. So it's a lot of times you really have to understand where they are in this journey, and you have to be very careful. This is where technique comes in to sort of get them to release it because they hold on to it for fear, the fear-based
Absolutely.
energy.
Yep. And the fear of what then it looks like afterwards, especially if I've then become, like you said, I am the worrier. So now I am the worrier, but what if I don't worry anymore, then who am I? And what do
Right.
I do? How do I handle things at that point?
And the mind will
Yeah.
come in and say, if you don't worry, that means you don't care. And
Mhm.
that's not true because the mind sometimes gives us really bad information and advice.
Yes. That it does. That it
Mhm.
does. So then with that knowledge, knowing that our bodies will seek out things, whether it's something that's positive for us or not so much, to alleviate those negative feelings, what are some practices that folks can do to alleviate some of that discomfort without it being a negative thing?
Well, certainly self care is a must. And you would be surprised how many people really don't invest in themselves, such as sleeping, eating well. I mean, we're always on the run, we're eating, we're drive through eating and so forth. And when we do this, we're constantly sort of running at a loss. Now we're becoming stressed because the day's getting busy and so forth. Now the mind's going to get very active. And this is when we go to our quick fixes. I tell people all the time, if you have to go in and have major surgery, but you're in pretty good health, you should do fine. I mean, you should have probably 6 weeks and you'll be often, back to normal or relatively normal. The same thing, but when we're psychologically not in a good place, we're going to, something stressful is going to happen and we're going to have a really hard time recovering. Same as if you have surgery and you're already very sick.
Yeah.
Self
Yep.
care, people are terrible with self care.
Speaking about self-care, what does that look like? I hear it often, and there are people that are really busy. You've got multiple children and sports and jobs and all of the things. Where, like, what does it really look like for a person that's not necessarily an excuse? Like, that's real life. What do you do when life is that
When,
pushy and
when
busy all the time?
When life is busy, absolutely.
Yeah.
Certainly, when you have children, though, you really have to look at sort of objectively how much is too much. I have a lot of people where the kids are in soccer and whatever else they're doing, karate and so forth, and the parents are running from thing to thing to thing to thing to thing. It's just a little bit, and I understand that it's important for them to do something, but not everything.
Yeah.
There's balance in that. Sleep hygiene is very important. I power down a couple hours before I'm getting ready to go to bed, and I do things like either take a bath or a shower and do some reading and some meditating just to sort of get myself ready to go to bed. I
Okay.
don't have any devices in our bedroom because I just feel like that's not the place for technology.
Mhm.
So, everything is out. I mean, I'm probably one of the rare people, but a lot of people stay on their phone right until they put it down and go to sleep, and then the minute they wake up, they pick up their phone and they start again.
Yeah.
Very hard on the nervous system.
Hey.
My first 15 minutes of my day, I spend in like a quiet meditation, and then for me, no technology for the first hour.
Wow.
It's
That's
it's
impressive, Denise.
Well, it's really too much stimulation because
Yeah.
I was getting up, run to my email as if something emergent, there's an emergency at 6 a.m. And then I would already start, my mind would be, oh, I'm never going to get all this done. Oh, I have all this to do. Now
Mhm.
I get up, I take some time, I find my center, and then I take an hour and I'm in Florida, it's usually nice. So we go outside and watch the birds come to the bird feeder. And
Mhm.
in an hour, then I start my day. Then, then we're rolling.
Nice. Okay. Okay. That's very admirable and something that I know I probably should be doing more of. So thank you for that little nudge and push to myself and the listeners. So on top of self-care, are there other practices, other techniques? Maybe you mentioned meditation. So is that something that you would suggest for others or maybe even some mindfulness techniques?
Certainly meditation. And I teach that and it depends upon what people are interested in. That
Okay.
was varies. I love things like acupuncture. People and it's what people really gravitate to. I could name a lot of things, and it depends upon whether that would be something interesting to you. Monthly massage is very important, particularly because many of us are on devices and we're sort of hunched over all day long. So again, but not everything requires money.
Right.
We certainly can't afford to do everything, but There's certain things like walking and getting out in nature that's very good for the body and the mind and the soul.
Absolutely. Absolutely. Can you touch a little bit more on those not so money based practices? Because I know, especially these days with inflation and the cost of everything increasing, expendable funds is difficult. And that could also be anxiety inducing, trying to figure out where I get money to make myself feel okay.
Sure. I love being out in nature. I think that that's one of the easiest things that we can do. Certainly, any sort of exercise. With kids, it's nice to go out and watch, throw a ball or whatever you do with them. Game night is really fun with kids. When we play against each other and so forth. So there's a lot of things that we can do where we can all put our devices down and spend some time together.
Absolutely. And then what I'm loving about the things that you're talking about, they aren't something that I have to go and do something special with or go and spend a bunch of money to learn about. They're things that I can really just pull from, our listeners can really pull from their own home, their own backyards to enjoy to help
Mhm.
ourselves.
Yeah, reading is wonderful. When we're reading books and so forth, we're creating and we're imagining, and that's really good for the what they call your higher selves.
Nice. Nice.
We'll be right back after word from our sponsor.
Continuing education is both a requirement and a learning opportunity, but finding the right CE provider can be challenging. AATBS, a triad company, offers continuing education for psychologists, social workers, marriage and family therapists, counselors, and behavior analysts. CE courses are available both individually and as part of our new All Access Pass. All Access Pass provides a library of over 250 unique courses. That's more than 800 hours of CEs, with new courses being added every month. As a special offer, Behavioral Health Today listeners can save 15% on CE purchases. Visit us at aatbs.com/BHT and enter promo code BHT15 during checkout. That's aatbs.com/BHT. Check out our library and check off your CE requirements today.
So I've talked with lots of other practitioners, other mental health professionals, and the connection that you are making between the mind and body is something that I don't know that I've heard very often. Of course, I can see it, for myself as a social
Mhm.
worker, but I don't know that I hear that very often from other mental health professionals. So what kind of insights can you share with colleagues?
Well, a lot of times, with any sort of critical stress or trauma, and we saw this with COVID, it makes a lot of things that maybe we haven't dealt with bubble up.
Mm,
Because when the mind becomes very active, the mind only knows its experiences. And so we saw with COVID, a lot of people were eating and drinking because a lot of past stuff, we had a lot of time to sit and think.
yeah.
And that's when the mind gets very active. And that unfortunately, these are where these low vibrational energies that are fear based come up: shame, guilt, anxiety, even jealousy is a very heavy emotion that will a lot of times bubble up under chronic stress and trauma.
What are some ways that you are able to take clients from the low vibrational energy to different ways of thinking? How are you able to help them?
One of the, I guess, the easiest is reframing.
Mm,
Because many times when people tell a story, I call it they go dark very quickly. Emotions come in a neutral way, but we take our own experience and we go very dark. Oh, the worst may happen, and you don't even really know what the situation is, and all automatically you're going to this negative space.
right.
So a lot of times I'll reframe it and I'll say, well, what if something good happens? Or what if, because I feel like if I'm sort of a spiritual person too, I feel like when things happen to us that are not ideal, there's lessons and meaning.
Mhm,
We don't particularly like those very much, but there's a purpose to them.
mhm.
So instead of holding it and feeling shame and guilt and negativity, we can also look at it a little bit more positively and look at more of experience and gratitude and growth and whatever other word you want to put in. It's a little bit with a better or higher meaning.
Absolutely. Reframing is probably one of my favorite tools to use with people, really trying to help them see things in a different way. And it can be really simple to do, or on our end, I guess. But it is difficult for clients or patients to see things from a different side. That can take some time. But speaking of that, what are some other tools and techniques that you use to help clients manage the physical effects of the stress and emotional pain?
One of the things that I try to do the most is really teach. Because when we experience any situation or so forth, we feel it in our bodies. And so what I try to get people to do is let's not panic. Let's notice, let's understand. We tend to jump to a conclusion and we get way ahead of ourselves. With situations, they're going to play out the way that they are going to play out. Certainly, we try not to do anything dangerous, but a lot of times we have to let these things unfold
Yep.
without panicking. But we do. We panic and then we go right to what's going to happen. And the mind gets too active too quickly. And that's just a sign that the nervous system's not in balance.
Absolutely. And just a bit ago, you touched on COVID and maybe even how it changed the world basically and how we thought and related to ourselves and to others. I am curious then, what do you see changing as far as practitioners? How did we change? And how did just the mental health practices period, how did it change and evolve during that time?
Well, certainly we all got very good at using Zoom. So we
Absolutely.
got creative. And certainly, fortunately, a lot of people were reaching out during COVID times and so forth. But I everybody looks at it like it was a terrible situation, and it certainly was. A lot of people lost their lives, and I certainly don't want to say that sort of on the side. But there was a lot of good things that came out of it. I think it sort of brought mental health to the forefront,
It did. Yeah.
and so for that, we learned to be creative. We learned to address some things that maybe we haven't addressed. And I saw a lot of silver linings to that.
Absolutely. I completely agree with you. While it was a rough time for sure, and it's surging again, but in the midst of that, it definitely brought to the forefront how important mental health is and making sure that you are addressing things that are going on inside. Like you said, we
Mhm.
sat with things and we sat with ourselves for so long that we needed to address it. So for that, I am somewhat thankful that it occurred.
No.
Yeah. So, what are some challenges that you've encountered in integrating holistic approaches? So, your approach is different. Not every clinician thinks that way. So, what types of challenges have you seen and encountered, and what did you do to combat them?
I think some of the major challenges is I rarely get a referral from a physician, which I think is, I mean, I'll get from word of mouth. I'll get somebody that, unfortunately, many people are finding counseling on their own.
Yeah,
And yet I see children, teenagers, and or people younger and younger getting sicker and sicker, and they're prescribed this medicine and that medicine and so forth. And the in the healthcare in medicine, no one's recommending counseling and having somebody to talk to, which I think is very unfortunate.
absolutely. Absolutely. And so, then how do you think that we can combat that?
Well, certainly, I try to do it by doing a lot of public speaking. I volunteer down at the police department and so forth. But I will tell you, people are resistant to come. There's this old thought of you only go if there's something wrong with you,
Mhm.
and yet it's actually just the opposite. People who want to stay healthy, certainly physically and mentally, sometimes you need a therapist to work through some things. We all do.
Absolutely. I believe we all need therapy. And it's kind of surprising. I mean, I know it's there, but it's kind of surprising that the stigma still remains even with the increase of, mental health being in the forefront during COVID. It is kind of surprising and unfortunate that there is still that stigma that is there. Do you have any thoughts on how we get around that stigma?
It's tough. I got an email this morning here in Florida. Unfortunately, first responders, law enforcement, they're a lot of taking their lives. It's just coming and coming. It's almost an epidemic with them, and yet they're very resistant to come for therapy. They feel like this is a part of them that they should sort of be tough and handle the job, but they experience a lot of vicarious trauma, and they have their own problems. And unfortunately, this is something that I think as mental health counselors, we're really sort of challenged to reach everybody, not just people that sort of find us.
Right, right. I completely agree with you on that challenge. I'm trying to bring the people in that are a bit resistant to it for whatever reason, because of course, stigma is there, but then there's other reasons that come along with that as well.
Mhm. Yes.
On the positive end of that, do you have a hallmark story of someone that you've worked with and integrating this holistic approach? And what did that journey look like? What did success look like and feel like for that client for you?
I had a client not too long ago, probably about 65, uh, really very successful man, came in. He had grown up in foster care and he married someone right out of high school. I want to say, maybe 2019. They had children. And throughout his life, he became very, very successful in business and he was able to retire early. So they retired and the kids were all out and doing well and so forth. And his wife came to him and said, I don't feel like we have much of a marriage. You don't open up to me. You don't talk to me. He would interact with the children, but it was more for like problems. It wasn't really an emotional connection. He was the go-to guy.
Yeah.
And he's good about answering sort of matter of fact questions, but when it came to sort of that heart to heart connection, no one felt close to him. So his wife said, yeah, I don't want to live out the rest of my life with, not having any sort of deep connection with somebody. We see that a lot in Florida. We see a lot of, we call them gray divorces. And so they separated. So he decided, he found me on his own and he came to me. And the first or second session, I can't tell you how many times it was, I heard the word fear and guilt. I feel guilty because I don't know why I was so successful when, I came from foster care. He didn't feel deserving of it, which is really sad. So we started to work through that. And certainly I'm sort of speed going through all this process. But after a while, that guilt and shame started to lift and he began to find some happiness. Certainly he had earned it. He had made a very successful life. And I sort of brought that to the forefront. I said, you made a lot of choices despite your circumstances, and had a wonderful family and you should be very proud. And once he looked at it that way, it just sort of shed new light on, and they ended up reconciling. And so far, they're doing fairly well. So it was a wonderful story. He did a
Awesome.
lot of
Awesome.
work, though. I mean, I guided, but he did all the work.
Absolutely. And you know what? Speaking of, you mentioned that he was 65. And so this is something I didn't really think about till you said it, but do you think that this holistic approach is it something that any age group can benefit from? Do you need to have, decades of lived experience? Is this something that a teenager can benefit from?
Everybody can. Every developmental stage that we go through, we will thrive or not. So that's one of the things that I'm looking at. In Florida, I see people sometimes 60, 65 and older. So either they're doing very well. I mean, down here they're all playing pickleball and golf, and we're living
Good
the
diet, yeah.
self-absorbed life down here. But we're also seeing a lot of people in despair, a lot of marital issues that people have been married 45 years, 50 years because all of a sudden now they don't want to live the last 10 or 15 years in a loveless marriage or whatever they've been struggling with.
Absolutely. Okay. That was just curious, something that just kind of popped in my head when you said his age. So looking forward to the future, what do you think are some opportunities for the future of healthcare in incorporating that mental and physical health more effectively? Because I'm fairly new to the medical field now as a social worker. I do see some of the doctors that I work with really talking with our patients about their mental health. So then what do you think is the future? What do you see happening?
I would like to see us a little bit more connected between medicine and psychology. I think when doctors prescribe antidepressants, which I'm not against, I certainly understand, but I also think that that needs to go along with therapy. And a lot of times I just see that people come in and they're on this medicine, that medicine for anxiety, but unless they've come on their own to get some counseling, no pill is a magic pill.
Absolutely.
And so I think that we could do a better job of working together instead of sort of working as separate entities.
Absolutely. I agree with you. I agree with that because I will say I said some doctors because some of the other ones I work with are like, oh no, depression stuff, that is all you, social worker. I am not doing that with you.
Mhm.
Just tell me later if you wanted me to give them meds. So
True.
I completely agree with you in that process. The connection is definitely helpful for our patients and clients.
Or they'll give them medicine and then that's it. It's see me
Yeah,
in a month. Now let's see how you're doing. But we're not understanding why they need medicine in the first place.
right. We didn't even touch on why you feel the way that you feel, why
Right.
you're anxious, why you're depressed, why, that kind of thing. It's not a deeper questioning or a deeper understanding of it. It is just take these meds, see me later,
And
which
this
is
is where the
unfortunate.
critical thinking really comes in, where you've got to understand that we got to this place. Why? And what could we be doing that could help them, maybe help the medications work a little bit better, or maybe they don't even need them.
Absolutely. Okay. And speaking of that, then what kind of advice would you give to healthcare professionals looking to incorporate a more holistic approach into their practice?
Well, I think every medical doctor, PA, whoever they are, I think they really need to have a list of practitioners that are local that they can use, they can resource to.
Okay.
Certainly, I'm in private practice, but a lot of doctors, and I had, when I first went into practice, I sent my cards to everybody, never got a referral from not one of them,
Mm.
which I think this again is a real disconnect.
Yeah. Yeah. It is. I can't even disagree with that. It is absolutely a disconnect that happens there. And I'm not sure where that comes from, but it is definitely a level of disconnection.
Mhm.
So, for our listeners that are interested in exploring more about your work or the mind body connection, what are some resources where they can learn more?
Well, I've written a book. It's called Healing Your Body by Mastering Your Mind. And toward the end of this show, I hope you'll post my website. If listeners will email me, I'd be happy to send them a copy as my gift for listening today. It's a wonderful little resource.
Thank you very much for that. Thank you.
Mhm.
And you mentioned your website, and I will say I generally, kind of check out people that come on before, just so I can kind of get an idea of the things that they'll talk about, their background. And one of the other podcasts that you had done was really interesting to me. It talked about social media and teens, and while that is not necessarily the topic of today's conversation, it is quite interesting to me. And so I just wanted to hear your quick take on the effect that social media has on teens and what can we do as parents to, kind of change that.
I'm so glad that you mentioned that because I think a lot of what causes a lot of anxiety, particularly in kids, is we're overstimulated. Kids are just overstimulated. And what happens when the nervous system becomes out of balance? So we have anxiety and so forth. The body eventually wants ease because chemically the body's responding to the mind. The body's listening to the mind to know what to do, and the mind's not giving it the best information, worried about this, worried about that.
Mm.
And so when we go to ease, one of the fastest things that we are, the quickest thing that we grab for is our cell phones.
Mhm.
And we start scrolling and scrolling. We drop a lot of dopamine. The dopamine comes flooding out of the brain. And unfortunately, with kids, it's too much stimulation. They remind me sometimes of drug addicts because when I try to take their screen time away, I've had a couple like want to try to punch me. I mean, they really get very violent, and they. Yeah, I just had a case not that long ago where the family got all the kids to power down by 9 o'clock, and they took all the devices into their bedroom, and at I don't know 12:30, one little one was coming in and getting the device back out. Okay, that's pretty concerning.
It is. It absolutely is. And like you mentioned, it is almost like an addiction and they're receiving these positive feelings from it, but then don't necessarily know how to disconnect from that. So again, I know that's not necessarily what we were talking about, but it was just something that as I was scrolling through and listening to, tidbits of other podcasts that you've been on, it was something that was quite interesting to me. So listeners, I hope that you will spend some time on her website listening to her other insights because she's got a lot of knowledge to share with us for sure.
Yeah, it's a double-edged sword too, because a lot of the kids think that their life should be what they see on Instagram and so forth. And
Right.
so,
And then those of us who lived before social media, telling my age here, lived before social media, I don't necessarily need to be validated by others, but I have a 10-year-old who wants to do all of the latest stuff that he sees on, just as I scroll through my Snapchat or TikTok, he wants to be doing those same things. And he is only 10 and really has no idea about life in general, but it really does have a profound impact on, and I'll say not just teens, because children are getting access to phones and things like that much earlier than we ever did.
Yes. Plus, you're seeing what the other person wants you to see,
Hmm.
not necessarily what their life is. So they're showing
Absolutely.
little parts of their life that make their life look fantastic, which is great, but that's not all of their life. As we know, as social workers and clinicians, there's a lot that goes on behind closed doors with
Absolutely.
everybody.
Absolutely. And then, as you mentioned, it sounds like you may have even treated some families or children that had maybe even anxiety that it was created from, social media usage or even internet usage, period. What does treatment look like for that?
Well, it's interesting because what happens with them also, so they have a lot of anxiety. Many of them are perfectionists. And so what happens, sort of the flip side of that, is they struggle with a lot of chronic exhaustion, procrastination, and so forth, because after a while, the body just sort of runs out of gas. So I see this sort of pendulum of, and then as soon as they get out of bed, then they go to this anxious state. So that can be really, really challenging because I'm seeing kids younger and younger with a lot of anxiety and panic, perfectionism. Again, we're overstimulated. It's a lot, and it's a lot for all of us to manage, but it's
Yes.
something that really needs to be addressed.
It definitely does. It definitely does. And I say it may not even just be in young people. Sometimes as adults and parents, we kind of struggle with the same.
Sure. And believe it or not, I see a lot of couples. It's one of the things that really starts to cause a disconnect.
Mhm.
He's on his phone, she's on her phone, they're sitting next to each other, they never say a word to each other, and they're both very lonely, which is interesting. As well connected as we all are, a lot of us are very lonely.
Right. Because we lack that real human interaction. It's through a device.
Mhm.
Yep. Okay. Again, I do apologize, listeners. I
Oh,
kind of got us off topic a little bit, but it is something that is quite interesting to me, and I do think that it not only affects children, but it is something that everyone may experience or has seen in others. So I thought it was important for us to bring it up and just kind of discuss it, glaze over it a little bit, and
mhm.
hopefully spark some interest there in subjects for others.
I'm glad you did. It's a great topic.
Yes, ma'am. It is. It
Mhm.
is. And Denise, I really have appreciated speaking with you today.
You're welcome. Enjoyed being here.
Absolutely. Again, listeners, check out her website. It will be linked. And thank you so much for taking the time to join us. The resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.